Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Medical Officer for Women's Health, Dr. Carolyn Howerway-Smith. Remember, you can text your questions to 336-379-5775, the number right there at the bottom right-hand side of your screen. All right, this first text question is, I've been told by people they're not getting the vaccine because they know people that have died from the vaccine. Is this true?
So I have not seen any studies where there are deaths related to the vaccine itself. I think most of that is just false literature. There have been a few patients who have severe allergies that have had some reactions, but even those patients, if you have severe allergies, let the site know. And they'll watch you a little bit longer. And every site is situated so that they have EpiPens available in case there's an allergic reaction. But even the amount of allergic reactions in patients with known severe allergies, those allergic reactions are very, very limited. So number of deaths from COVID, none that I'm aware of.
Mm-hmm. Although we have heard of many people after having the second shot feeling not so good. So what are the normal kind of side effects that go with that second shot?
Yeah, so on the Pfizer, you get your second dose 21 days later, and on the Moderna, you get your second dose 28 days later. And for some people, around 7 to 9 hours after that second dose, they can have chills, fevers, body aches, pain in the arm. Although this isn't the majority of patients by far, probably 30 to 50% of patients feel like they just are coming down with the flu. And that is completely normal. I recommend when that happens, take a Tylenol or an Advil and get a good book and sit down for a good read, because within 24 hours, all of those symptoms should be gone.
All right, and I think it's important to know, because we've had lots of people ask, they can take the Tylenol or Advil after the vaccine, but they shouldn't take it before the vaccine. Why is that?
I'm not aware of advice that they should not take it before the vaccine. They can take it before the vaccine as well.
So this is a question. This person is saying, if I've been invited to a gathering indoors for 14 people, all of them have been vaccinated, is it safe to participate without your mask on?
Yeah, so the CDC has come out with recommendations saying that if you're in a environment where everyone has been vaccinated, then you should be safe to not wear a mask. I want to be careful there and say this, though. At this point, we should still be avoiding large crowds. We should still be washing our hands, and we should still be, as much as possible, wearing masks, especially if you're in an environment where you are not sure that people are adequately vaccinated. And by adequately vaccinated, I do mean the first and second dose of the Moderna or the Pfizer, or the first dose of the Johnson, and then about 10 days to 2 weeks after that. That's what we consider fully vaccinated.
Right, it's not the moment that you leave from your second shot. It is days later.
Correct.
Okay, this person says, I got my first shot and it made my blood sugar go way up. Should I be concerned about getting my second shot?
So I'm not aware of a situation where the vaccine would, or why it would make your blood sugar go up. So I would recommend talking to your provider about that, because I'm not sure what that relationship would be related to.
And maybe they might have some other kind of situation that would play into that. All right, this person says, will we need to get the vaccine again in the future, like the flu shot?
So that's a really good question, and the answer to that is we don't know. And so one, it isn't known right now how long this current vaccination will last. And it also depends on the herd effect. So when people talk about the herd effect, what they're talking about is the majority of people are vaccinated so that the virus has nowhere to go. So if we have good herd immunity, we may not need a second shot or a booster. So more to come on that. COVID and the coronavirus 19 is still very new. And so there's so much that we don't know. And as time goes on, we'll learn. And as we know, we'll share it with the public.
Mm-hmm. This person heard you talking about allergies, and if you have them, that they have people to watch. And so they asked a follow-up question. What do you mean is severe allergies? I have allergies to cats and trees and pollen and grass, or do you mean allergies to medications?
So that's a good question. When I say severe allergies, if you have to carry around an EpiPen, you're probably someone with severe allergies, and you should notify the site when you go there. And what they'll do is they will watch you for a little bit longer. There are always nurses on hand to have the EpiPens just in case, but they would just watch you a little bit more closely and for a little bit longer just to make sure.
Mm-hmm.
But again, even people with severe allergies who do use an EpiPen who've had the vaccine have done very well.
All right. We're going to continue this conversation and continuing to take your questions, and we'll be back in just a few moments.